Good afternoon and welcome to our event tonight. We're going to spend some time with you talking to you about a wonderful report with all of the findings from some research that we did. We are excited to have you here with us. We're going to talk about COVID and public transportation here in our Houston region. And welcome to the event.
Go ahead, next slide. So some housekeeping, and I guess it'd be a good time to introduce ourselves. I'm Harrison Humphreys with Air Alliance Houston, one of the lead authors on this report. Presenting with me is Dr. Denae King with Texas Southern University, and we will be, we'll be leading the discussion today. So just again, some brief housekeeping. We are providing simultaneous Spanish translation today for this webinar. If that is something that you require, here are the instructions on how to do so, and we're going to hand it off to our simultaneous translators to give some instructions. Erwin, if you want to go ahead.
Thank you, Harrison. This message will be transmitted in English and in Spanish. So hi everyone, my name is Erwin Madrid, and alongside with my co-interpreter Alejandra Esparza, we'll be interpreting in English and Spanish during today's session. First of all, we'd like to thank the organizers of this event for their commitment to language justice and creating multilingual spaces. Language justice includes being able to speak, understand, and to be understood in the language in which we feel most comfortable. Creating multilingual spaces is not only the responsibility of the interpreters, but also everyone here. That's why we'll be sharing some guidelines so you can help us out. For those presenting today, you can help by speaking at a moderate pace, loudly and clearly. If we need to speak slowly or loudly, we'll let you know through the chat. For all participants, please don't suffer in silence. If the interpretation is not working or you're having other technical difficulties, please let us know in the chat so we can help you. The interpretation function in Zoom has been turned on. You should now see a globe in the lower part of your screen with a message about language interpretation. Click on the globe and select the language in which you would like to participate in and listen to during the session. If you're joining us through a smartphone or tablet, please click on the three dots on the bottom right-hand corner of your screen, select language interpretation, and then select the language in which you would like to listen. Make sure you click on done and you'll be all set. Hola, muy buenas tardes a todos. Mi nombre es Irvin Madrid y junto con mi cointérprete Alejandra Esparza estaremos interpretando en inglés y español durante la sesión de hoy. Primero que nada, queremos agradecerles a los organizadores del evento de hoy por su compromiso a la justicia del lenguaje y al crear espacios multilingües. La justicia del lenguaje incluye poder hablar, entender y ser entendidos en el idioma en el que nos sentamos más cómodos. El crear espacios multilingües no es solo la responsabilidad de los intérpretes, sino de todas las personas presentes. Por eso les vamos a compartir algunas pautas para que nos ayuden. Para los presentadores de hoy, pueden ayudar al hablar a un ritmo moderado, voz alta y claramente. Y si necesitamos que hablen más despacio o más fuerte, se les dejará saber a través del chat. Para todos los participantes, por favor no suban en silencio. Si la interpretación no está funcionando o está teniendo otras dificultades técnicas, déjenos saber a través del chat para poder asistir. La función de interpretación de Zoom ya está encendida y pueden ver abajo un globo terráqueo en la parte inferior de su pantalla con un mensaje sobre la interpretación de idiomas. Haga clic en el globo y elijan el idioma en el que les gustaría participar y escuchar durante la sesión. Si nos acompaña a través de su celular o tableta, puede hacer clic en los tres puntos en la esquina derecha de parte de abajo de su pantalla y elija interpretación de idiomas. Después seleccione su idioma y asegúrese de hacer clic y finalizado y estarán listos. Harrison, we're good to proceed.
Thank you so much. I think we can go to the next slide, Cassie. So, go ahead, Dr. King.
So today we are going to share with you some of the qualitative and quantitative findings from our report. and also some of the recommendations that derive from the findings. And then we'll have some information about the federal infrastructure legislation that's currently being considered and negotiated in Congress. And later we'll have a question and answer session on the future of transportation in Houston and in Texas with a wonderful group of panelists that include community stakeholders and policymakers here in the Houston area. And there'll be a question and answer session, and we'll have some closing remarks. Next slide, please.
So I'd like to take just a quick moment to give some special thanks to all the parties that made this report possible. Our funders for the project, the Robert Wood Johnson Foundation. I'd like to thank the Urban Institute for their technical support on this project. The community research team members, some of who have joined us today on the panel and will be answering questions later, as well as the community members who participated in the roundtable discussions. Your input was essential to the study. Finally, I'd like to sincerely thank Link Houston and Texas Southern University, including our own Dr. King here, for partnering on this project, putting together some amazing research and data, and dutifully attending weekly meetings despite the fact that I was leading them. So I appreciate that, and thank you all. Next slide. So to start off, I think it's important to contextualize transportation planning in Houston prior to the pandemic. If you're from Houston, live here, or have ever heard of Houston, you'll probably associate the city's transportation with driving and sprawling freeways. And you'd be right. In 2019, Houston trailed only the Dallas-Fort Worth area for the highest vehicle miles traveled, or VMT for short. VMT measures the total miles that vehicles travel in a given area and is a primary metric to track transportation usage. In January 2020, Harris County was estimated to have 154 million daily vehicle miles traveled. Coinciding with this, though, transit was steadily increasing in the years leading up to the pandemic. Houston was one of the only cities in the US to see such an increase. And in 2019, voters in our region overwhelmingly supported a $3.5 billion package to expand and improve Houston Metro services. And this plan was called Metro Next. I'm certain at least one of our panelists will have more to say on that shortly, but we'll get to that. As you can see from the many graphics on this slide, Metro Next was far from the only planning initiative in our region prior to 2020. Others included the Houston-Galveston Area Council's Regional Transportation Plan, shown here in the bottom left, which outlines the next 25 years of transportation investments in our 9-county area. The City of Houston's Climate Action Plan and Vision Zero's framework, seeking to address our carbon emissions and deadly roads, respectively. And it wouldn't be an Airlines Houston webinar if I didn't mention TxDOT and their various designs on the region. Oh, I'll go a little bit slower. Including TxDOT's mammoth $9 billion North Houston Highway Improvement Project, shown here in the bottom right. So no shortage of planning in Houston. But to some, the Houston region, long reliant on cars, continued this habit as it grew over the past decade. But there is also signs of a growing reliance on transit and plans that support that growth. Next slide, please. At this point, I think it's also important to discuss the inherent value our team attributes to public transportation, something we try to establish in the report and a theme we often return to throughout. The central argument we form is that reliable, accessible public transportation provides an invaluable public good in several different respects, a good that is often overlooked or not adequately considered in transportation planning. In Houston, public transportation facilitates a number of benefits for the public. For example, it is a tool for achieving racial and social equity. According to Link Houston's 2018 Equity in Transit report, Black and Brown Houstonians made up 75% of Houston residents, according to the 2017 census, and 78% of transit riders. Link also found that in Houston, prior to the pandemic, 40% of local bus riders lived in households with no vehicle. So improved public transportation is central to both the City of Houston's Vision Zero plan, and the Climate Action Plan as well. The Climate Action Plan, or CAP for short, calls for a drastic reduction in vehicle miles traveled, which will require thousands of Houston residents to switch from driving cars to other modes, like buses or trains. In terms of safety, driving a personal vehicle is one of the more dangerous modes to take in Houston. Unfortunately, the ubiquity of cars and lack of pedestrian infrastructure means the amount of people driving makes it dangerous to walk or bike in Houston too. Expanding transportation mode options and treating all modes equally in terms of safety is essential in efforts to reduce traffic crash fatalities. And yes, public transportation does relieve congestion. Most don't immediately think of it in that way, but investments in public transportation will pay dividends for people who want to continue driving as more people move from their cars to buses and the like. Next slide, please. So, given that lengthy context, we began our research attempting to answer three central questions. How did the COVID-19 pandemic impact residents' access to and utilization of public transportation? And if access was limited, how did this impact access to other basic needs, such as getting to and from work and school, obtaining food, accessing healthcare, getting to work? Second question that we asked was how the pandemic impacted residents' plan to use public transportation in the future. And finally, given that increasing access to alternative modes of transportation is a key component needed to achieve a number of our local and regional goals, what policy proposals and or funding investments should be prioritized? And this is kind of where we started from. Next slide, please. Given our resources and timeline, our team needed to narrow our scope. We just weren't able to look at the entirety of Houston. So we decided to focus on three specific communities for study. In order to determine which communities to focus on, we considered several different criteria, including respiratory hazard quotient, which is a measure of air quality, social vulnerability index, which is a CDC tool, which uses a number of social and economic variables to determine vulnerability. We lined that up with COVID infection and mortality rates in Houston. And finally, we compared that with Link Houston's fantastic Transportation Equity Demand Index, or TEDI for short. From these determinants, our team identified three general communities to focus on. So we picked out 3rd Ward, 5th Ward in Cashmere Gardens, and Sharpstown and Gulfton. Each of these communities are more racially, ethnically, and socioeconomically diverse than Houston or Harris County at large. A greater proportion of residents rely on transit to reach employment in these communities, and each area had a higher COVID infection and mortality rate than Houston as a whole. Next slide, please. So, in order to assess the impact of the pandemic on transportation in Houston, our team looked at a number of metrics to better understand traveling patterns in our region. Our top line findings are listed here. As you might expect, VMT dropped precipitously in Houston, as it did most everywhere in the US. Between January 2020 and April 2020, daily VMT, again, that's vehicle miles traveled, dropped 79% in Harris County. Metro ridership dropped significantly as well. However, this was not true for all communities, particularly for low-income communities where essential workers were more likely to live. A prime example of this was Sharpstown and Gulfton, who actually saw an increase in ridership in October of 2020 compared to 2019. This was a common theme. Throughout the pandemic, essential workers in Houston and Harris County who continued working in critical industries and services throughout the height of the pandemic continued relying on public transit as a primary mode of transportation. Looking at air quality, and at the time of writing this report, the air quality data was somewhat inconclusive, but we saw relative improvement in air quality, but not across the board. We saw a drop in NOx emissions, and that was measured in several areas, and that was probably due to the drop in the number of vehicles traveling. However, diesel fueled freight continued moving throughout the pandemic, which continued contributing to air quality issues in Houston. Moving on to the literature review findings. In compiling this review, our research confirmed what many others have stated already, which is the pandemic severely exacerbated existing social and economic inequalities. Health experts identified almost immediately that COVID-19 was devastating Black and Brown communities at much higher rates than those of their white counterparts. Throughout the pandemic, Black and Latino residents' share of total cases and COVID-related deaths have far outstripped their share of the total population. Studies suggest that people of color are at higher risk due to higher exposure and transmission. In Texas, where nearly 66,000 people have died from COVID as of this week, and that's almost assuredly an underestimate. The Latino population has borne 46% of COVID deaths, despite only making up about 40% of the population. Finally, unsurprisingly, we found that the challenges Metro faced over the past year and a half were near universal for transit agencies across the country. Fears of contracting COVID while using public transit dominated public perception and still deters riders today. Fare box revenues everywhere collapsed, leaving many agencies with little operating capital. We'll be asking Metro Representative Kurt Larson about how Metro is weathering these challenges shortly. Next slide, please.
So I had the pleasure of leading the community roundtable part of the project. And so I worked with community leaders from the three collaborative communities, really to kind of understand the impact of COVID on communities that rely on public transportation. And so the community leaders assisted with developing focus group questions and were later trained to actually facilitate the virtual focus groups. They also recruited all of the participants for the community roundtables. We provided translation services for some of the roundtables, and in some instances, focus groups were even done in Spanish. And so I wanted to make sure to highlight our community co-researchers, of which two will serve as panelists later in the Q&A session. And so Dr. Asada Richards represented the 3rd Ward community. Ms. Nikki Hawkins-Knight represented 3rd Ward. Ms. Ghislaine Williams represented the Sharpstown Gulfton community. Ms. Sandra Rodriguez also represented Sharpstown and Gulfton. Ms. Huey German Wilson represented the Cashmere Gardens and Greater 5th Ward community. And Mr. Keith Downey represented Cashmere Gardens and Greater 5th Ward. Next slide. So the transcripts from the virtual focus groups were analyzed, and we basically looked for similar themes across the 3 communities. And then the findings from the focus groups basically suggest that participants without access to a vehicle continued using public transportation for work purposes, suggesting that many of our community participants were essential workers and were valuable during our COVID time, or I guess continue to be valuable during our COVID time. And then participants also discussed reduced usage as the literature shows because of COVID fears, and also because of limited places to visit, during our shutdown time. So then other issues there were other issues related to safety and also equitable access that seemed to be more enhanced during the pandemic. And so participants voiced concerns related to COVID-19 precautions, such as cleanliness, lack of access to hand sanitizer, mask, and social distancing enforcement on buses in the rail system, and also equitable access to efficient and timely bus and rail routes and safe bus shelters. Next slide. And so I know this is difficult to see, but we wanted to kind of share with you some of the actual quotes from some of the participants. And so one of our questions was related to the decision to use or not use public transportation because of the pandemic. And for the most part, in all of our communities, the participants said that they continued to use public transportation. And we asked them the question of, did the pandemic change their ability to really get to some of the places that they needed to go to, like work and school, medical care and shopping and food and essential items? And many of them said yes. They said that it was longer wait times and reduced capacity on the bus because of social distancing requirements. And some participants said that some of it made it a little bit easier depending on where they live, because there were less people sometimes, and it was easier. There were easier commutes. So that differed a little bit. Some participants said that they totally stopped using bus service and switched to Lyft and Uber because they felt safer if there was just one person versus several people, as it relates to public transportation. And then when we asked questions about whether or not they were planning to use public transportation in the future and why, most of the participants said that they were planning to use public transportation. We asked what would make them more willing or comfortable with using public transportation. And many of them said that, it's needed for work because of their lack of vehicle ownership. And so social distancing and proper COVID safety precautions were listed often in terms of what would make them feel more comfortable. Next slide.
And I'll just briefly, as an aside, we do have some prepared questions for our panelists in the second half of this presentation, but we'll also be taking audience Q&A. So at any point, feel free to enter a question into the chat box for any of our wonderful panelists today. But moving on, we concluded the study with a number of interviews with area stakeholders. Additionally, we interviewed some organizations based in Chicago and New York to try to understand how other cities fared during the pandemic. I won't spend too much time on this slide because we do have a great panel of stakeholders here today that we can question live, and I'm sure they'd be happy to answer them. But to briefly sum, we asked our array of stakeholders about their perspectives of the impact the pandemic had on our region and how it'll shape the future of transportation. When asked to share their thoughts, nearly all identified the precipitous drop in the various modes during the height of the lockdown and beyond. However, several interviewees clarified that this was not the case for all residents in the region. Coinciding with our quantitative data and our discussions with community members, stakeholders reiterated that a clear divide existed between residents who could either work from home or afford not to commute and those who could not. Job and economic status were a clear indicator here. When discussing this trend, Bill Fulton of Rice University's Kinder Institute explained that in Houston, office workers are better paid, more likely to be white, and have better job security. Workers who must work on site are lower paid, less likely to be white, and are more at risk to lose their job and contract COVID. So while public transit ridership and passenger vehicle usage went down dramatically, transit remained a lifeline for essential workers. Our conversations with associates in New York and Chicago gave us some interesting insights as well, and we can advance the slide. Not surprisingly, these cities saw similar changes in travel patterns. When asked about the biggest impact of COVID on transportation in Chicago, Linda Lopez of Active Transportation Alliance replied that, quote, the ways it changed the workforce and how the workforce moves in the city and the region, and who kept working in person versus working remotely. We definitely saw drastic ridership declines, especially on rail. This mirrors the observation of the workforce divide pointed out by Fulton in Houston and the feedback we got from our New York associates as well. So I've put up this quote by Oboyo Reed, leader of Equiticity in Chicago, because I felt that it really cuts to the heart of the issue. Oboyo spoke to the quote, three-way intersection of challenges Chicagoans faced. And to quote at length, so you have COVID, which Black and brown people bear the brunt of. Then you have this focus on essential workers in our region who are all mostly Black and brown. Then you have those two things intersecting with income. In Chicago, the poor people are Black and brown. Because of that, financially not in a position to consider other modes of travel. And because of that, when they do stretch themselves financially for other modes of travel because they don't feel safe in transit, that has a much greater impact on their finances as opposed to wealthy people. So for me, what it exposed was the dearth of options for people beyond transit. Through these conversations with advocacy groups in Chicago and New York City, we were able to draw some similarities in the challenges faced by our respective cities during the pandemic. And it seems almost universally true that the working class neighborhoods and communities of color were hit hardest by COVID in a variety of ways, from higher case counts to greater economic insecurity. Essential workers who suffered increased risks being exposed to the virus in order to keep their jobs came from these neighborhoods and often relied on transit. Next slide, please. So that brings us to the conclusion of the report, our policy recommendations, the first of which is displayed here. Federal and state government must expand funding to support public transit as an essential service for people in the broader economy. The additional funding should allow flexibility for application to both capital and operating expenses. So as we've tried to establish throughout the report, reliable, accessible public transit is an essential service that many of the most vulnerable rely on for basic needs. The pandemic highlighted and deepened many of the stark socioeconomic and racial inequities, and further proved transit's indispensability as a public service. In addition to the economic, social, and safety benefits it can provide, public transportation is a key element of combating climate change. In 2014, Texas produced 175 million metric tons of CO2 equivalent, or carbon dioxide equivalent, from on-road and fuel cycle emissions alone, essentially cars on the road. And this accounted for 0.5% of total global greenhouse gas emissions, which seems relatively small, but it far outstrips Texas's share of the global population. So our carbon footprint from cars alone is astounding. Currently, Metro receives no operational funding and no dedicated funding for capital improvements from the state of Texas. At the federal level, funding is heavily weighted towards road and highway improvements, although the legislation we'll discuss in a moment may shift this somewhat. Either way, the state must first remove the barriers to providing funding to public transportation authorities in large urbanized areas, then reevaluate its funding priorities. Two resolutions filed during the past regular legislative session, H-GAC 109 by State Representative Armando Wally and S-GAC 40 by State Senator Boris Miles would have done just this, but both items died in committee, unfortunately. Next slide, please. So this brings us to our second policy recommendation, which is Metro must restore services to pre-COVID levels, continue to equitably implement service improvements in the Metro Next plan, and partner with other public and private entities on a public information campaign to educate and reassure the public and riders. So this is somewhat of a dated recommendation, but not entirely, because when at the time of the writing of this report, we were in June, and Metro ridership was still very much so down. And I think we'll get an update from Kurt here, but a lot of this recommendation has to do with Metro restoring, I guess not trust isn't the right word, but assuaging fears of hesitant riders that might choose a different mode based on fears of COVID-19. I think, and Kurt will be able to speak to this a little bit more likely, but Metro has taken a number of steps to ensure the safety while using their facilities. And that's what this recommendation sort of speaks to. Next slide, please. And finally, our last recommendation coincides with the first. Increasing funding for public transportation is really only half the battle. And I'll go ahead and read this one out. Local, regional, and state level planning entities must reorient their planning priorities to address changes in behavior brought about by the pandemic to meet current and future transportation demand, most specifically for people walking, rolling, biking, and riding local transit to affordably reached opportunity. So local, regional, and state policymakers must reorient planning priorities to match the evolving needs of our growing population. We harp on this a lot at Air Alliance Houston, but we simply cannot afford to continue building roads on a business as usual basis. Not in terms of our alarming traffic safety numbers, not in terms of creating an equitable transportation system that serves all Houstonians, and certainly not in terms of combating the ongoing climate crisis. This will require a fundamental reshaping of how we evaluate and plan our transportation infrastructure, starting from a base of establishing what the real needs of the region are. As part of this effort, transportation planning entities must move towards a more community-led planning model. Too often, transportation projects in our region do not engage community members to discuss project needs, potential impacts, or design feedback until late in the project planning and execution cycle. This often results in poorly planned projects that do not adequately address the real needs the community is intended to serve, or is implemented in a way that is unnecessarily detrimental. Community-focused planning that incorporates input early on in this process may address these issues. Next slide, please. So that is the conclusion of our report. This next section, I'll give a brief overview of the federal infrastructure legislation. The two major pieces of federal infrastructure legislation that are currently being debated in Congress. Now, because the situation seems to be pretty much ever evolving, I won't comment on the politics or the likelihood of either bill passing. I'd probably be wrong anyways. That being said, we can comment on the bill's contents, which are laid out here. So this is the smaller, often referred to as the bipartisan bill, which it seems a little funny saying 1.2 trillion is smaller, but it is the smaller of the two bills. And new spending actually only represents 550 million of that 1.2 trillion figure. So as we can see, a majority of the new spending, or plurality, I guess, is dedicated to roads and bridges, which is a sort of business as usual approach. 66 billion has been allocated to railroads, Amtrak and freight, but not high-speed rail. 39 billion to public transit, and I won't list all of these out, but those are sort of the main sections. And we can see that there's also some non-related non-transportation infrastructure that will receive some funds, such as 65 billion going to power grid and 65 billion going to building out broadband. Next slide, please. So how much of this bill will find its way to Texas? According to a recent estimate, we'll get about 27 billion for roads, less than $1 billion for bridge repair here in Texas. And against that 27 billion number, we'll be getting about 3.3 billion for public transportation. And as just a quick reminder, Metro Next, the Metro building out plan we referenced earlier in the presentation, represents 3.5 billion on its own. So it's a small number what they've allocated for public transportation in Texas. And then 1.2 billion will go to airports. Next slide, please. So the larger 3.5 trillion bill, $3.5 trillion bill, the contents of which are much murkier and much looser, but we know that they will be focusing on what they're calling human infrastructure, which is clean energy development, climate resiliency, housing. They're going to be changing up the tax codes. A lot of that will go to education. They'll be working on paths to citizenship for immigrants and a lot more. And this one's a little murkier about what's in it. And both bills are currently in the House. There's plenty of politics, and there's plenty to read about that. But neither have passed, and both represent significant investments into infrastructure. So next slide. At this point, we'll move into our panelist discussion. I think Dr. King was going to introduce our panelists.
Thanks, Harrison. So we're excited for this part of the presentation today. And so we'll have Dr. Asada Richards, who was a part of our community research team, Ms. Nikki Hawkins Knight, who also participated as a co-researcher, and Ms. Sandra Rodriguez. And then we'll also have our Houston City Council member, Dr. Letitia Plummer, and Houston City Council member, David Robertson, and Kurt Lurson from Metro. Okay, so let's get started, panel. Our first question, I think, should be to Metro. So we just kind of, left some information left open from them. And so, Kurt, can you give us an update on the state of Metro's current ridership? I think people want to know that.
Sure. At the height of pandemic, our ridership dropped pretty precipitously as the lockdowns went into effect. And as you mentioned, a lot of office workers and others were sent home. We very quickly pivoted and reduced the amount of service that we were providing. We suspended all of our park and ride services, which largely served those major employment centers where we had office workers, downtown, the greenways, with the exception of services to TMC, which was obviously still employing lots of people in person during the pandemic, and focused on our local bus system. We were proud that we were able to keep all of our local bus service running. We had to pivot to running basically weekend levels of service on all of our routes, but we felt it was important to run all of our local routes so that folks had a chance to continue to move around to do the essential trip making that they wanted to. So our ridership dropped from the sort of 280,000 range pre-pandemic, all the way down into the 120s and the 130,000 a day. And it has gradually increased since earlier this year. We're now in the 150s, 160s, now that school is back in person for most districts this year. But the spread of the Delta variant here in the last 2 months has really put a cap on what we had anticipated in terms of ridership increasing. So we have seen progress. We are still running. We are starting to add back local service where we can, where we have the drivers to do that. And we are still running significantly less park and ride service. We have restored service in each one of our park and ride corridors, but it is we are only running about 30% or so of the service that we were running pre-pandemic. So right now we're carrying about 55% or so of our pre-pandemic ridership on our services.
As a quick follow-up question, one of the participants says that the new bus network implemented in 2015 introduced over 20 routes, and they ran like every 15 minutes, 7 days a week. But since COVID, at least 6 of those routes have seen their frequency cut to 30 minutes. And so they want to know if there are plans to restore and expand that frequent network.
Sure. Our board has done a wonderful job of navigating the pandemic from a financial standpoint. And right now we do have the resources to add service as it's needed from a financial standpoint. Our biggest challenge right now, and we're not unique to a lot of other companies, we're having hiring challenges like most companies. We are short over 150 bus operators, dozens and dozens of mechanics and cleaners, and that is hindering our ability to add more service back at this point in time, as it is with most transit agencies across the country. Again, we are not immune to the hiring challenges that many businesses face. We are increasing wages and benefits and stepping up our recruiting efforts, but it is an ongoing challenge as again, many companies, cities, counties are also hiring. in school districts and others. So we have plans to add back the service that we had reduced as we are able to, again, find operators, mechanics, and cleaners to operate and maintain those services. So we don't expect those to be permanently reduced.
Great. So I'll direct the next question to our community research team members. Thank you for coming today, Nikki and Dr. Richards. Both of your, or I guess we originally had a member from Sharpstown as well today, but your community third ward has been hit particularly hard by the pandemic, harder than most other Houston communities. How is the pandemic continuing to impact the third ward today?
I think I appreciate the invitation. I appreciate the opportunity to have this conversation around transportation and the spotlighting the impact on particularly Black and Brown communities. And I think, you know, the consequences that without adequate transportation, then many of the other necessary opportunities are not there. So in our focus group, we heard from mothers who had to get their children to and from school, right? And that without having reliable transportation, that even the school districts and the schools are seeing a change in attendance and enrollment. The other issue is that if residents in our neighborhood, which is a neighborhood that's being disproportionately impacted by development and residential displacement through what we know as a trend of gentrification, if residents can't get to and fro from work, right? If they can't have adequate transportation, and you heard some of our residents say that they felt unsafe, right? Riding the bus, not enough lighting, not enough reliable routes, not enough bus shelters, right? And so without having that dependable transportation, then our residents aren't able to secure the employment that's necessary for them to live in a neighborhood where rents are increasing as well. The other impact, which I think was interesting, was in our particular group, you had someone who was a personal care provider, providing home care to very vulnerable residents. And she talked about having, you know, the people that she cared for, and others not being able to receive their providers, right? Their providers not being able to get to attend to them. And so she saw that there were elders and seniors that were suffering. I mean, I think that, you know, a big part of this is just, you know, when white America gets a cold, we know Black and Brown communities get the flu and pneumonia. And so this is a additional undermining of really the social safety net of our communities. But I think what we do know is that our communities were very resilient. And I want to say, I think one of the things, can I just say that was so interesting, that we see riding the bus as some sort of punishment for being poor. But there were residents who looked forward to riding the bus. They looked forward to having the opportunity to be in community, right? To be in connection with one another. And so I think we don't have to educate people on the bus. We just need to make it possible for them to use the bus, right? And so I don't want Metro to do any more campaigns. Get out your car, because the people who need it and who are willing are already out their cars, right? Just use that money to get them to and fro. So I just want to say that, you know, I think the transportation conversation just unearthed the fact that, as the person said from Chicago, that, you know, Black and Brown communities continue to be undermined, and the resources that we need are not being put into those communities disproportionately as a rescue plan. We're talking about the American Rescue Plan, but we know we need to do more than rescue America. We need to save, restore, and provide reparations and repair for Black and Brown communities. Thank you.
So I don't know how I'll come after that, Dr. Asada. You basically said it all, but I echo those same sentiments, but I'd like to also add that some of the things we heard about and that we continue to deal with in Third Ward is access to food, right? Even though There were amazing food drives that happened. Gardens were still producing and making sure residents had access to fresh produce. With some of the, new development happening, signature grocery stores and other agencies were moved out of neighborhoods to go to more affluent places and really made it difficult for people to access food. Additionally, as the ripple effect happened, the same thing with healthcare. So whereas you could get to, the medical center using a trusted mode of service from Metro's line, you had to wait more time. You had to wait longer to get there safely, even for routine healthcare. So healthcare was at a deficit. And then the last thing I'd mention is that, as Dr. Richards said, riding the bus is not a punishment. Many people are able to reclaim their time being on the bus, not having to drive, not having to worry about parking, and really understand the benefit of having a trusted partner to get you in and around the city. It's really a conversation from policy to people, having these conversations connect so that we can understand what the end user experiences before we start talking about policy and dollars and what's best. The people who use the bus are super viable assets and resources to get information to pivot policy in a way that's most beneficial. So our group was really interesting. We really found out some amazing information. And I think that if we hear and adhere to what's being said to make the necessary changes, we'll see the transit system really benefit Black and Brown communities.
Thank you, Dr. Richards and Nikki. So based on the comments from our community researchers, Dr. Plummer and Councilman Robinson, what do you think in terms of the ongoing pandemic? How has your view really shifted as it relates to transportation and the future of transportation in our region?
Go ahead, Dr. Plummer.
I was going to defer to you.
Oh, boy, well,
as my senior council member.
All right. Well, I'm happy to respond. I love what's been said so far. I love the detail of the report, and I couldn't agree more with the recommendations, and just maybe pick up on a couple of things that Dr. Richards and Ms. Hawkins-Knight just mentioned. It does need to appeal to all riders. And while, one thing that I've been asked a lot is really a question that assumes that somehow COVID has set us all back. And I want to say that doesn't have to be the case. And I really like what I've seen in the world of technology. Here we are on a Zoom call. A year and a half ago, I didn't know what Zoom was. I didn't like Facebook. I'm not an especially vain person. I'm a politician, so I'll defer to y'all for your opinion of, me on that or whatever. But, I don't like looking at myself. So, while we're going on Zoom, this has become a thing about how to communicate. And while we're talking about transportation, we need to focus on those items that can transform what Dr. Asada said. Shelters and sidewalks. We need to make it the choice, the preference, which is really hard to do in Houston, Texas. I've not traveled at all to speak of over the last year and a half, and I love to travel. The 2 trips I've taken have both been to visit my parents in the Northeast. And when we get home there and we get to the city, our cars go away and we get on the bus. That's the local bus in Boston. That's the subway in Boston. That's the subway in New York City. That's Amtrak between cities. And so we're at a starting point where we've got a mental attitude that is really tough for people to get used to, but where the investment has been decades and decades behind. There are some things that I see Metro trying to do that I love because it's consistent with the goals that have been laid out for sustainability, for a more resilient set of transportation options. And the point I'm making about technology is we are accelerating where we're going, but we've got to do the basics right, which is where we get to shelters and sidewalks. And those investments, let's take Third Ward, and the sidewalk summit that was recently held. I mean, we got deplorable infrastructure in a real basic way. And, I'm all for the Metro Next plan, and Kurt knows that I'm a big champion of doing that and then some and more. But it really is a challenge for us in the energy capital of the world, and our devotion to cars for those of us who can afford them. But for what we're discussing so far on this panel, this is really an existential challenge for our communities of Black and brown people and impoverished white and other people. And this is something we've got to deal with as a city, as a region. I see great promise in the plans that are being laid, and I just want to accelerate that as much as possible. So yes to more funding, yes to the packages coming from the federal government, less obstructionism from the state of Texas, more collaboration between us and TxDOT, and certainly us in the county. Where can we multiply the investments that have been made? And let's just increase that funding, I think that was laid out, both for the capital investments as well as operational facilities, maintenance. I mean, golly, the state of the shelters out there, I don't care how much you love riding the bus. If it's raining out, shoot, you ain't going out. You got to have a big umbrella. So I don't know. I'm encouraged by our design. Again, part of what I do as an architect and part of my presence on city council is to try to raise the standards of our expectations, try to enforce that our authorities, my friends at Metro, our public works people, our planning department, all of the collaborative entities across the H-GAC for our regional investments, we've got to make multimodal options available. I think COVID, I'm going to go to my grave an optimist. I see it as an accelerator technologically, embracing multimodal transportation options. We have got to do it. And it goes fundamentally to the energy capital of the world, and, committing ourselves to alternative energies. Somewhat like the portfolio of the energy that we consume as a city. It's 100% in wind and solar. And, let's demonstrate that. Let's get our bikes out. Let's walk, but we can't walk if the sidewalks are bad. And we can't really get on the bus if we don't have a good sidewalk to walk on to get to a shelter that can protect us if there's a storm or, a cloud burst. So, I love what we're saying. I love the conclusions. I'm a little impatient, and I feel like I know where we're going and I want to go.
Thank you. So we also can't walk if we don't consider climate change and environmental concerns in our community. And so last year,
real quick, did we want to give Councilmember Plummer a quick
Dr.
chance to
Plummer,
respond?
yeah.
Oh, I was getting ready to give her a good question.
Okay, well, yeah.
I'm thinking of you, Dr. Plummer.
No problem, no problem.
I know she has an interest in health.
Yeah,
Yeah, I know that she has an interest in health, so I was trying to give her one that I knew she would be passionate about. So last year, the city released its climate action plan, and it really called for a drastic reduction in driving. And so given that we just talked about the billions of dollars that are going to be, or potentially will be spent on roads and road infrastructure, what is your role as a council person in transportation planning? And how would you navigate that when you think about the health of your constituents?
No, I think that's a great question. And thank you so much for allowing me to be a part of this conversation. This is really multifaceted. It's got to do with the planning piece. It's fiscal responsibility as the money comes down to us. And it's also a part of social vulnerability and really acknowledging what that looks like and what that is and how it affects really all people, but specifically people that do have challenges. And I believe that what COVID did teach us or show us it really highlighted what an essential worker looks like and how vulnerable we actually are. And when we don't plan for those potential issues, looking at those social vulnerabilities, we don't plan for it properly, we don't take these opportunities to do so, we just see those communities suffering more and more and more. And the layers of issues that Black and Brown communities experience are something that just are continuous setbacks. And so, you know, in this place, what's a little bit frustrating often for me is the lack of communication amongst our partners. You know, we just in our transportation, just independently, we've got multiple departments that touch everything. No one really comes together and decides on how infrastructure should be laid and what communities may need and how that looks, how the big picture looks. And so a PFM report was done in 2017 and recommended that Houston have a true department of transportation. And that would give a centralized location to where all of us communicate. And so when we communicate, we talk to our neighborhoods, we talk to our communities, understand what those needs are, and then we move in a cohesive, moving forward direction. And I don't know if we do that very well. We work in silos and we make decisions independently. And I believe that if we can come together and make those decisions collectively, then communities wouldn't hear of projects like an I-45 expansion at the 12th hour. We would hear about it way in advance, and we'd have those conversations, and we would know how those decisions are being made and how they actually affect communities. And so I believe moving forward, it's great that we've created our climate action plan. It's great that we have Vision Zero. It's wonderful that we want to make sure that people use bike lanes and get out of cars and into other modes of transit. But how are we planning to do that? What's our strategic plan? Are we using the data to determine how is that executed? Are we listening and bringing communities together at the beginning and not at the end, where we're finding ourselves spending all this extra resource and money redrafting plans, when if the conversation happened at the front end, we wouldn't have to do any of that. And so Black and Brown communities are essential workers. It is something that we are proud of. It is something that is absolutely necessary. And it is the literal reason why Houston was able to continue to do what we needed to do during COVID. And so if those are the people that we're depending on, how do we not create micro transit options for them to make sure that they can get to work when we knew that the resources dropped down because ridership changed? And so we have to very quickly shift. And so using those social vulnerability factors and making sure that we're, really utilize them to make our decisions moving forward, I believe is going to be crucial to allow Houston to move forward. But communication, it starts with that.
Thank you, Dr. Plummer. That's a great segue.
I just want to say, and I don't want, I think the challenge for me is that we're all acknowledging the disproportionate impact of COVID on Black and Brown communities. And that acknowledgement should carry through when these billions of dollars come from the federal government, right? Because that's equity, right? We can't talk about equity. Equity is not only the acknowledging of disparity, but it is the shifting of resources to disproportionately address those disparities, right? We can't only want to talk about disparity when we're talking about the problem. When we get the resources, I want to see the allocations from the county, from the city, and the federal government earmarked disproportionately to the Black and Brown communities that have suffered. Otherwise, we are benefiting off of the suffering of people. And I don't do that, right? And so I just want to say that this same work, when these dollars come down, the same way we talked about Black and Brown communities were disproportionately impacted, we should be having that same conversation when we allocate where this money is going to go and what communities are going to benefit at what percentage, because it's no longer fair for Black and Brown communities to continue to suffer and only be utilized to talk about the suffering. But when there's resources come down, then there should be a reparative strategy. And reparative strategy is bringing those resources to address the harms that were done. So, I heard what Councilmember Robinson said, the harm is done. Whether it's going to be a moment or not, that's going to be for us, right? Because the suffering has already happened. You can't take away my suffering, right? But what you can do is elevate your humanity to deal with my trauma and have a reparative strategy to then move me forward, to acknowledge that you learned and you're willing to work with us to create a better Houston. If we're not, and then better to Harris County, if we're not willing to do that, then this is just an exercise.
I think in the same way that we've had disproportional investment, we need to have disproportional reparations and accelerate in the communities that have not been invested in. Absolutely.
And if I could add one last thing, the decisions that we make also have to be sustainable. We need to look at how we spend money within the city of Houston, and we have to make sure when we make these investments that we factor in maintenance. So these investments are able to, are sustainable.
Great. So there's a participant, Julia, who is, she's concerned about low-income communities, missing sidewalks. That also includes lack of curb and gutter drainage infrastructure. And she wants to know, how can we ensure that work is done through an equity lens and also through a lens of walkability and disaster mitigation, so that we can improve communities that have historically been disinvested in. So I think that any of you could probably take that question.
I think that's a wonderful question. And, I often say that zip codes matter based on where you live. And it's incredible. It's important, as, COVID has done one thing for us. It's really brought attention to the needs of communities because we all really were able to sit at home and really figure out, what matters and what doesn't. And one thing, to answer her question specifically, we need to make sure that we look at Houston as a whole, not based on property taxes, not based on average income. I mean, we're talking about human beings. And so there are communities that shouldn't look the way that they do in specific zip codes. And we need to start there, put the infrastructure in those communities, level the playing field, bring those communities up, and then spread the love basically across the board. But currently that just isn't happening. We tend to invest resources in neighborhoods that are higher wealth. And that's a problem.
Thank you, Dr. Plummer.
And if I can, Dr.
go ahead.
King, if I can just make a statement, I think similar to what Councilmember Plummer said earlier, is that we have to look at a broader planning process. Planning coordination has to happen on every level. With some of the great things that Metro is doing with their infrastructure and pad replacements, they have a certain linear foot of sidewalk they're adding as a component of their last mile efforts. The city of Houston, Harris County, everyone's looking at sidewalks and connecting people. But when we talk in a broader context, we need to look at other agencies who are placing infrastructure within our city, developers, the TERSs, developer agreements, and what those standards look like, how we hold everybody accountable for connectivity in one way or the other. When we talk about drainage, when we talk about being studied, because Third Ward is one of the most studied places in the entire world. And out of all those studies, how do we take those studies, as Dr. Richards said, and make them a reality? How do we implement and drive dollars to address those issues and not use Third Ward as a case study, right? We know what the issues are. They've been identified a long time ago, and we have other areas of town that have similar disparity. But when we talk about the allocation of resources, the use of funds, and the agency's role in managing the projects that go in these neighborhoods, I think everyone who has interest and buy-in in that particular neighborhood needs to come to the table to address these issues collectively. I'm talking center point, private, public public and private relationships, everyone has a stake and everyone benefits from being in the community. I think everyone should have the same responsibility in making sure the community is sustainable and safe for those who reside there, no matter of the socioeconomic status. So I agree. I think we have to do better with our planning and coordination efforts, so someone doesn't come in and put a sidewalk down and 6 months later the next agency comes and tears it back up. If we start as we start looking at our tax dollars, we have to look at being good stewards of what we have agreed to manage, what we've agreed to maintain, and how we have agreed to use tax dollars. So planning coordination is one of the keys to making sure we have solid connectivity and infrastructure in Third Ward.
I'd like to, and I'm about to throw it back to Kurt, but I'd like to just comment on that specific issue. A prime example of studying the issues and then not doing anything about it. The Houston Galveston Area Council, H-GAC, put out an environmental justice report. It was probably a year or two ago now, but that identified a lot of the issues that we're discussing today. And and it outlined very specific recommendations on how to remedy those, but it's not really been incorporated in an effective way at the H-GAC level. But throwing it back to you, Kurt, we had one question in the chat from Reverend Caldwell, and I wonder if he's still on. I think he is. He wanted to know about the impact of the COVID pandemic on drivers. I'm assuming he's talking about the Metro drivers. And then I also wanted to ask, and I don't want to be putting the cart before the horse here, but has Metro considered, if these federal funds being discussed right now do come down the pipe, how they might be utilized?
So thank you for that. We definitely have had an impact at our agency and our contractors. We've had over 900 employees test positive for COVID since this began. We've been very transparent with the public. We actually release those numbers every day so folks can make decisions about how they travel. When they are folks who are in public facing positions, such as bus operators, we share what routes they were driving, what days, so people can take appropriate actions if they feel they need to get tested or monitor their symptoms. So it has definitely been an impact. We have had, as I said, almost over 900 Metro employees and contractors have tested positive. The vast majority of those folks have recovered from that, but it continues to put a strain on us and the ability to provide service every day. As many folks are, even under the best of scenarios, they're out for 2 weeks when they catch it. A number of folks obviously are required to quarantine because they're close contacted, even when they don't test positive. And they all have family that they live with who are obviously exposed and bring in different risk factors. So I think we're a microcosm of the community. You see our numbers increase when the numbers spike throughout the region. And we continue to encourage our employees and our contractors to get vaccinated. We have recently implemented a requirement of weekly testing. The city has moved in that direction as well. A lot of agencies are doing that to help ensure that we operate as safely in the community as we can. But it's an ongoing challenge for folks to stay healthy and allow us to be able to continue our service. And I don't see that ending anytime soon. So we continue to look at ways that we can, again, encourage vaccinations, enhance cleaning, provide social distancing where we can, and all other methods to reduce the spread. And I think we've been relatively successful in that manner.
Kurt, can I ask you a quick question before you, based
Sure.
on the spread? So one of the participants also wanted to know if you all had done any assessments on transmission in terms of public transportation?
Metro hasn't done any specific assessment. We have reached out to a lot of our partners. We're both with APTA, and we have regular conversations with other transit agencies in Texas on what they're seeing, both from a manpower standpoint, from what policies that they're implementing, what seems to be working and not working. The research that has been released has been pretty conclusive that transit has not contributed to the spread of COVID. It is primarily and again, I don't pretend to be a medical doctor in this, but primarily from being in close contact with folks for long periods of time without taking safety precautions like wearing a mask. So we've been very successful in, as I think a slide earlier, we've handed out over 2 million masks to our customers over time. We will continue for the foreseeable future to hand out masks. There is hand sanitizer on all of our vehicles for the public. We've installed driver shields to keep them separated as best we can from the public when they're boarding, and obviously have to come in relatively close proximity when they pay their fare. So we continue to do what we can. Fortunately, with transit vehicles, the changing of the air within the vehicle itself plays a large portion. A lot has been published about on airplanes because it is a relatively sealed environment and recircled air. Well, every time the bus stops, the doors open, the air is sort of refreshed on the bus. We have stepped up our ability to change filters on the buses as we can. But again, it's really about refreshing the airflow on the bus. So we've not found anything that has particularly, that would be more helpful than, again, disinfecting the surfaces on the bus. It really hasn't been an airflow issue for us. And none of the research has really suggested that relationship. And I know there was a question about funding. It will be wonderful, whatever funding materializes either from the infrastructure plan at the federal level or the Build Back Better plan. All of those things will allow us to move forward and implement projects quicker that have been identified in the Metro Next plan. And if there is even state aid that happens, that we'll be able to use that as matching funds to apply for other monies to again move projects forward. We've tried our best these last years, again, as Board Member Robinson talked about, use this as an opportunity to really jumpstart a number of plans. We have one of the big promises that we made to the public for better bus services as part of Metro Next was enhanced bus service with our Boost projects. And we have the first one that we're implementing is the 54 Scott, which runs right through Third Ward, right through the heart of Third Ward, from downtown past U of H, and then all the way down the corridor, ultimately ending in the Hiram-Clark community. And that involves, again, improving headways, improving the bus stop experience, rebuilding sidewalks, crosswalks, the infrastructure along the way, signage to make it, because again, as Mr. Robinson said, if you can't get a good walk experience, if you can't get a good wait experience, it doesn't matter how good the bus or the train experience is. So we're working with our partners, both at the city and the county, to rebuild as many sidewalks that connect to all of those, looking where we can extend those sidewalk projects to neighborhood destinations of importance, whether they be schools, whether they be grocery stores, if they're half a block or a block off of that route, to get our biggest bang for the buck and really be good stewards. And we're excited as we're making good progress on that project, because we want to do 14, 15 of those in the coming years. And those will, I think, be really important for improving the service and access for a large portion of our community.
Thank you, Kurt. Go ahead, Dr.
I wanted to make sure to offer Dr. Richards and Ms. Hawkins Knight an opportunity to share if they have any other interesting thoughts or suggestions they'd like to share from what they heard in their community roundtables.
Thank you, and apologies for interrupting you, Kirk. You know, I'm working from home and I have these bonus children here, but this is real life over here. You know, I'm encouraged because I heard, you know, so much resiliency in the stories of the residents, right? How they figured it out and how, you know, the reality is they stayed on those buses because they had to. And they had to get where they needed to go for themselves, for their children, for one another, and for the community. And so I'm looking forward to, you know, I have my co-op shirt on, and co-ops are about really, you know, workers taking control of their economic opportunities and creating businesses that serve them. I was on a call this week with a group out of Canada who, you know, worked on their own community neighborhood-based ride sharing and transportation, you know, businesses, right? That they started, that they own, that they operate, that they benefit from. And so I think, you know, while I heard a lot of challenges, I heard the possibilities of the solutions. You know, I'm tired of asking people to have grocery stores for us. Why we continue to beg and plead around the same old things, right? So there's an opportunity for us to create food co-ops. There's an opportunity for us to create transportation systems that will deliver groceries to our residents, right? You know, I'm just gonna say, you used to couldn't get a pizza in Third Ward, right? You couldn't get a pizza, like Pizza Hut would not deliver to Northern Third Ward. All of a sudden COVID hit and you can get everything. So if you could get it now, you could have got it then. There was no reason you couldn't do it. There was no willingness to do it, right? And so we have to stop for, I heard resiliency, I heard love, I heard devotion, I heard care and concern about one another. And I was excited to hear that. Young mothers and home care providers and, you know, and seniors and, you know, and I was excited to hear that, you know what my community said, no matter what, we're going to be here for one another. We're going to get up every day, put our best foot forward, and we're going to do what's necessary to take care of ourselves and one another. So that's what I heard in the stories, and I thank you for the opportunity. And so we're spending our time trying to find our own solutions to our own problems and taking those to our elected leaders, saying, this is what I want you to accept. And I just want to say, you know, there is no planning in this city, right? There is no planning. Let's just really be honest. We're not planning forward because we're not willing to plan. We're dependent on initiatives and projects and, you know, pet this and pet that and not having a long-term vision. But what I heard from the residents is that they are looking long-term and that they're willing to come together and be part of a project like this because they know their voices matter and they want their voices amplified and they're ready to get busy to work with organizations like Air Alliance and Link Houston and Texas Southern University to move their communities forward. So thank you.
And I totally agree. Again, I think that as we talk about, and I say this all the time, you know, we're in a very unique intersection of preference, policy, and people. And wherever that falls on your individual spectrum is how you deal with the issues in our city. But when we talk about moving forward and supporting the resilience that's in Third Ward, I really echo what Dr. Richards said. The community and the people thereof moved from a place of survival, right, to thriving through innovation and creativity, and really realizing that the things that were not previously available was a matter of preference and someone's policy. And now, because the need shifted and the way the conduit shifted, it became now a lifestyle. So you can now order a pizza in Third Ward, right? Some things that was previously a luxury or that you had to get on the bus to go get a pizza to then come back home and eat the pizza, it now became a part of a lifestyle. So I think that as we, you know, continue to commune with our community members and those innovative people and families and children who see the beauty in Third Ward. I think that more conversations like this that will make their way up to decision makers is super important, and not just talking about it, making sure there are plans and strategies and dollars put toward true implementation. And if it doesn't move past the conversation, then none of us have done our jobs. And so I think it's critical for us to make sure that we play a critical role in moving that needle forward and holding everyone accountable for their particular roles. Third Ward is a resilient and a strong community. And it's been through a whole lot, but I think COVID has unearthed a new wave of innovation, a new wave of courage and bravery, and a new set of voices that didn't previously think they had a voice. Now they have a voice and a vote in a way that they had never seen before. So I think that, coming out of this pandemic, and even now as we navigate these new variants, I think people understand their inherent power, but also their influential power in a way that they hadn't seen before. So I think great things will come from this. And again, thanks for including us in this study.
I mean, y'all's participation made the study. It wouldn't have been a study without y'all, so we really appreciate it. At this point, we got about 4 minutes left. I think we're gonna go in and close up. Cassie, if you could, we could still show that final slide. It's got a sign up link if you'd like to follow Air Alliance Houston, our organization. And I'm also going to be putting here in the chat, we've uploaded the final report, public COVID and public transportation in the Houston region. And that link is now there in the chat if you'd like to read it. Thank you everyone for attending today. We appreciate you coming to listen to our presentation, to be a part of this discussion. We thank Nikki and Dr. Richards for your time, both during the project and tonight. Council members Plummer and Robinson, thank you also for joining and providing your perspectives. And of course, Kurt with Metro, thank you so much for joining us today. And with that, that will conclude our presentation. Thank you all so much for joining us.
And there is an exit survey if anyone would like to respond to that for us.
Right, yes. There will be an exit survey auto-populating as soon as I don't know how it works, but it'll pop up as soon as you're done. Thank you all again.